Did you know that erectile dysfunction, or ED, isn't just an issue for the elderly? This common misconception often leads many to ignore the signs of ED, assuming it's a problem reserved for older men. But let me introduce you to Matthew Lucarelli. Matthew is a 36-year-old lawyer. He's not the picture of an elderly man, is he? He's young, successful, and lives in Cheshire with his wife Leah and their young son. However, last year Matthew and Leah started noticing that something wasn't quite right. Like many couples juggling demanding jobs and parenthood, they initially brushed their concerns aside. Things just weren't the same. Leah, an advanced practice registered nurse, shares, "We attributed it to the fact that we are both working parents. We both have stressful jobs and anxieties." But when the couple started trying for their second child, their concerns deepened. After a year and a half of unsuccessful attempts, they found themselves questioning, "What's going on here?" It was a question that prompted Matthew to confront the possibility of a medical problem. Encouraged by Leah, Matthew sought help and scheduled an appointment with a urologist specializing in ED. What followed was not just a medical examination, but also a deep dive into the issues at hand. Matthew found himself opening up about his problems, a step that was as surprising as it was necessary. What he left with was more than just a prescription for Cialis to treat his ED. He left with a clearer picture of his overall health and a newfound motivation to make lifestyle changes. As Leah recounts, the medication started to work almost instantaneously. But the journey didn't end there. This was just the beginning of a more profound understanding of ED, a condition not limited by age or health status. So, let's shatter the misconception. Erectile dysfunction isn't an issue exclusive to the elderly. It affects men of all ages and can often be a sign of underlying health issues. Matthew and Leah began to realize something wasn't quite right when they struggled to conceive their second child. And it's a realization that we should all take to heart. Recognizing there might be a problem, Matthew sought medical help, encouraged by his wife Leah. This step in itself was a pivotal one. The couple decided to seek professional help from Charles Walker, a renowned urologist who specialized in erectile dysfunction. This was a decisive step towards the journey of understanding and addressing Matthew's condition. The initial appointment was more than just a standard medical examination. It was an opportunity for Matthew to express his concerns, his fears, and his hopes. Matthew found himself opening up about his anxieties, about the stress of his work, and about the strain he felt on his relationship. This was an essential part of the process. It was about understanding that erectile dysfunction is not just a physical condition, but one that affects every aspect of a man's life. Dr. Walker, through his expertise and understanding, painted a clearer picture of Matthew's health. He explained that erectile dysfunction is a difficulty in getting and keeping an erection. It's a condition that can be influenced by a variety of factors, including physical health, mental well-being, and lifestyle habits. Matthew left the appointment with more than just a prescription for Cialis, a medication used to treat erectile dysfunction. He left with a newfound understanding of his condition and a motivation to make changes in his life. He understood that seeking help was not a sign of weakness, but a step towards reclaiming his health and his life. The prescription of Cialis was a significant milestone in Matthew's journey. It was a tangible step towards addressing the problem, and the results were promising. "The medication started to work almost instantaneously," said Leah, reflecting on the positive changes they noticed. This journey of seeking help was not just about treating a condition. It was about breaking the silence, about understanding the importance of open communication, and about taking control of one's health. As men, we often feel the pressure to be strong, to be unaffected. But recognizing a problem and seeking help is the real strength. It's about understanding that our health, both physical and emotional, is essential. With medication, Matthew's ED began to improve almost immediately. And this marked a new beginning in their journey, a journey of understanding, acceptance, and recovery. But Matthew isn't alone in his experience. An increasing number of young men are seeking help for ED. The misconception that erectile dysfunction, or ED, is a condition exclusive to the elderly is slowly being debunked. In fact, a study published in the Journal of Sexual Medicine in 2013 reported that 1 in 4 men under the age of 40 who sought help for ED were actually suffering from the condition. And alarmingly, almost half had severe ED. This is not a minor issue. ED can be devastating to men regardless of their age, and it should always be taken seriously. The Massachusetts Male Aging Study, a landmark piece of research, revealed that ED is more common than previously thought. It's projected that by 2025, more than 300 million men globally will suffer from the condition. It's crucial to understand that while most ED patients are effectively treated with medication, for some, the disorder is a precursor to heart disease. Dr. Charles Walker, a specialist in ED, estimates that ED is a cardiac risk factor in 10 to 20% of patients who do not have other risk factors for heart disease. How does this work? Well, during an erection, extra blood is delivered to the penis through the arteries. The arteries in the penis are the smallest in the body, so any hardening or blockages signs of heart disease can manifest here first. In other words, ED can be an early warning sign for heart disease, especially in younger men. Stanton Honig, Maryland, a urologist and director of the Men's Health Program at Yale Medicine, uses duplex Doppler ultrasound to evaluate penile blood vessels and assess whether a patient has early blood flow problems to the penis. So what does all this mean? It means that it's essential not to ignore the symptoms of ED, no matter your age. Young men, middle-aged men, elderly men, all can be affected, and all should seek help if they're experiencing issues. ED can be a devastating problem for men of all ages, but it should always be taken seriously. More than just a sexual health issue, ED can also be a harbinger of other serious health problems. It's not just about what's happening in the bedroom, but it could also be a signal of what's happening in your heart. You see, the correlation between erectile dysfunction and heart disease is more intimate than you might think. The arteries that carry blood to the penis are much smaller than those that carry blood to the heart. When there's a blockage or narrowing of these arteries due to the buildup of plaque, often a result of a condition known as atherosclerosis, it can lead to difficulties in achieving or maintaining an erection. But here's the kicker. The arteries in the penis are the smallest in the body, which means they're the first to show signs of arterial hardening, a precursor to heart disease. If you think about it, it's almost as if your body is giving you a heads up, a warning sign if you will. It's telling you, hey, there's something going on here that needs your attention. Now, this doesn't mean that every man with erectile dysfunction is on the cusp of a heart attack. But it does mean that if you're a younger man experiencing persistent erectile dysfunction, it might be worth taking a closer look at your heart health. Apart from heart disease, erectile dysfunction can also be a sign of other health issues, such as high blood pressure, diabetes, or even certain neurological disorders. It's a complex issue with a multitude of potential causes, and it's important to remember that it's not just about sexual performance, but about overall health and well-being. So, if you're experiencing persistent erectile dysfunction, don't just brush it off or chalk it up to stress or anxiety. It might be worth having a conversation with your doctor about what could be happening under the surface. In the end, it's crucial to remember this. ED can be a cardiac risk factor in 10 to 20% of patients who do not have other risk factors for heart disease. This isn't something to be taken lightly. It's a sign that your body might be telling you something important, and it's worth listening to. How do we differentiate between psychological or stress-related ED and ED that signals a heart disease risk? This question often pops up when we discuss the causes of erectile dysfunction. Understanding the underlying triggers can pave the way for effective treatment and improved health. Doctors can usually discern the cause of ED during an initial conversation. The language used by the patient can provide significant clues. Men who are generally in good health and use terms like performance anxiety often suffer from stress-induced or substance-induced ED. This is a type of erectile dysfunction triggered by anxiety, distraction, or excessive consumption of alcoholic beverages. Stress-induced ED is a common occurrence in today's fast-paced world. It's not unusual for the pressures of everyday life, such as work and family responsibilities, to interfere with sexual performance. Stress and anxiety can disrupt how the brain sends messages to the penis to allow extra blood flow. This disruption can prevent a full erection. On the other hand, substance-induced ED often stems from the use of certain medications or alcohol. These substances can interfere with the balance of chemicals in your body necessary for an erection. It's important to note that while reducing or eliminating these substances can improve ED, it's not a guaranteed cure. However, when ED becomes a persistent issue, It could be a sign of a more serious health problem, such as heart disease. The arteries in the penis are among the smallest in the body, so they are often the first to be affected by diseases that cause arterial hardening. This means that ED could be an early warning sign of impending heart disease, even in men who don't have any other symptoms. It's crucial to remember that erectile dysfunction is not just about sexual health. It's a complex issue that can indicate other health problems, particularly in the cardiovascular system. If you're experiencing symptoms of ED, don't ignore them. Seek help. You never know, it could save your life.